Hello, everybody tuning into the recordings at home. We are about to go live into the Facebook group. Just bear with us for a second as we head in. And we are live. Happy Thursday, everybody. Well, I've just lost my screen here for a second. Here we go. I'm Jade Scott. This is GrowthRx, and we are live at lunch today with the incredible Dr. Varma. Hello, Kiran, all the way from the Sunshine Coast today.
Hello, how are you? How's everyone?
So Kiran, our Dr. Varma, is joining us today to have a chat about building relationships with GPs. We're very thrilled to have you on board here today. A very, very impressive CV, which I'm actually going to read so I don't miss too much stuff here. But you have a keen interest in complex cases, particularly chronic pain, mental and women's health, lifestyle medicine. But in particular, you've got a unique interest and have partnered with the Cannabis Centre up there on the Sunshine Coast, which is the only medical cannabis centre in Queensland. Is that right?
Yeah, on the Sunshine Coast and north of Brisbane, yeah.
And you're also a clinical advisor for PharmaCan Global. So you've obviously got a few niches and a few passions there separate to obviously your general practice work and being the owner of your own business. So I can't wait to learn a little bit more about you and your interests today. But we'll start off with a few questions just to get everybody to know you. So how about we start with, if you could invite somebody to dinner, past or present, who would it be?
I think I'm gonna go with Muhammad Ali, and yeah, I've been seeing a lot of Mike Tyson videos recently, and it just sort of got me thinking more about Muhammad and how he was a bit of a driver of change in his time. So I think I'll go with him.
Absolutely, good one. And what about if you had a superpower? What would you like it to be?
I think I'll go with feeling emotion. I was going to say thinking, trying to figure out what the other person is thinking, but that might be a bit too much. So maybe just feeling someone's emotion a bit more would be where I'd go with that one.
Lovely. And in true leadership style, we like to embrace and recognise the contributions of the great leaders in allied health and healthcare globally. What does leadership mean to you?
Leadership is about it's about finding the right people as part of your team and getting them or helping them to grow and develop their own individual sort of skills. So it's being there for them and helping them develop their skills. Perfect.
Beautifully said. So today in particular, we've got you on board here, and I need to excuse everybody here. This is what happens when you go live. I now actually didn't realise our new kitten was in here, so excuse me. My apologies, everybody. So I put together a few slides for everybody today just to guide a little bit of discussion, but I'm hoping that we'll have a lot of interactive group interaction. So please feel free in the comments if you've got any comments as we're going through or feedback in regards to the discussion. But in particular, obviously, and I know Dr. Varma has a new practice up there, and it's only recently established, would you say?
Mm-hmm. It's about 9 months.
And so obviously you're at the beginning stages, but there's a lot of practitioners out there or new practitioners joining clinics. And one of the things that we know that sets the foundations for healthcare and good patient outcomes is the relationships and the network that we have as health professionals with our wider network and with our community. And one of those particularly being GPs. we've got established at our clinic over the years, and it's taken about 15 years to get to that point, but we've got some great relationships with our local GPs. We use their CDM program vastly. I know a lot of practitioners, work with NDIS, also Veterans Affairs referrals. But until you actually get to that point where you build that relationship, a meeting has to take place, and relationship and rapport needs to start and needs to be created. So one of the things that we want to talk about today is how we get to that point and how we best build those relationships. And the best person to go to is a GP with that experience in mind. So I've put together a couple of slides, hopefully just to sort of help guide our conversation here a little bit. And I'm just going to, now my screen has disappeared again. Sorry, everybody. Tech issues. Okay, so I'm just sharing this with you now. Just let me know. Can you see my screen there just yet?
Yes.
You can? Beautiful. Lovely. Okay, so one of the first things I wanted to discuss was obviously a great relationship is built on two main principles. The first one is appreciating that we have similarities, and obviously our common goal in particular is people, helping people, and obviously their vested outcomes and making sure that we're getting the best care for them regardless of what they present to us with. And secondly, respecting the differences. And with that aligns with our scope of practice. So both GPs and allied health professionals, we obviously want to be staying within our lane, not doing things outside of our scope of practice, and not creating confusion between those two roles. Would you agree with those comments?
Yeah, I think that's a very good quote. I'm not sure who it's by. I have heard it before, but not
I
actually.
couldn't find the author of the quote either.
Yeah, and look, it's there is every specialty or every job has something different to offer, and that collaboration is where we find significant improvement for patients.
Now, I've lost my screen here again, and I actually can't find you.
It's hiding.
You are literally hiding from my system. I'll continue going because we're live.
Yeah.
So I'll head back to my screen. I just can't actually pull you back into. Okay. So our first question is basically, what is the best way would you suggest connecting with GPs? We've got to make a first point of contact. Is that through writing letters? Is it through introducing practitioners, writing a letter about yourself of introduction, the services that you deliver, maybe just via patient correspondence? So after you see a patient, do you write a letter for every patient you see just to build that familiarity? Do you liaise with the practice manager and try and get a meeting with the whole team of GPs perhaps? Professional development work, so maybe offering a course or some upskilling for GPs just to help define that specialty, or making an appointment, for example, to actually just try and go in and have a chat. What have you found has been the best way of engaging with GPs?
So where I work and where I was working before, I've had allied health come and have a chat with me, and one of the saddest things I find is when they're booked in and I can't give them the time that they deserve or have booked in, and I'm running late, and it's frustrating even for me to be keeping someone waiting in that sort of manner. So to answer the question, I'm not sure if there's the best way to necessarily. Depends if the person inquiring is a new grad or a more senior practitioner, or a business owner. So what I would say is, in terms of getting in touch with the GP, I think all those points are important. Specifically, what I'd like to say is, if there is a new practitioner in town, or a new clinic in town, or there's a GP who's changed locations, those would be excellent sort of opportunities for you to build a relationship with them. And if that means, I mean, it depends on how their clinic is structured. If it means you can book in to see them outside of lunch, I think would probably be better, because lunchtime is just a little bit haphazard where I've where I'm working, and even where I've worked before. So it depends on the clinic, but at the same time, also finding those GPs who are just newly in that area, looking to, you know, find someone to refer to, can be quite useful.
And so how do you find, I mean, obviously you're really busy. So you've got this new energetic, let's call them osteopath, who has moved to the area and is about to open up a clinic, and they send you a letter, and maybe you're a little bit open-minded, but there are some very old school GPs who are very set in their ways. And obviously practice owners in particular, not only just GPs, but if you're running a practice, you can be very, very busy. So if it is just a matter of you know, arranging that meeting, would you prefer to be upskilling? Would you prefer to be getting some substance out of that and some education? Or are you happy for just somebody to just pop in and introduce themselves as they're kind of walking past? Or does it need to be that formal introduction and that formal meeting to get the best out of it?
So I think there's a couple of points here. The one time when this was a couple of months ago, when a patient came to me and said, I've been seeing so and so, they're an osteopath, and they helped me with, I forget exactly what it was. I think it was definitely musculoskeletal, and I was so impressed by what was done that I wanted to set an appointment with that person. So when I hear someone does really good work, I always look at what specific modalities they use. I know chiropractic, they have a plethora of different techniques that they use, or schools of thought and training. And specifically with this osteopath, I really wanted to see and form relationships. So I think if that, I'm not sure if you can, I'm sure there's a way that you can get feedback back to a person's GP that you are seeing, but that could potentially be a way that you could form an alliance, because if you've helped one patient for a GP, then you might be able to help more that they have, basically. The other thing is, I've also had physios provide education during lunch meetings, and that is excellent. And when they can teach me something like taping, or some sort of simple exercises that I can use there and then, or that day if a patient presents with a similar sort of issue, that's often very useful as well. So even, you know, for example, taping, if you bring tape with you and you show them or me how to tape for plantar fasciitis, and then, you know, I can get tape and do it the next day. Basically, I know how to do it, and it's a value add, it's a skill add for me. So that's been useful for me. And when I'm offered value in that way, you know, I'm just like, okay, fine. So there's only so much I can do for plantar fasciitis with taping. I'm going to send my plantar fasciitis case to this person, or my head and neck case to this person, because they've shown me something for it. So that's been very effective as well in my experience.
And so I guess from that, the take home is trying to be memorable. And if they're providing you with a skill or information that you're going to remember or continue to use day to day, then that certainly helps with increasing their level of specialty, I guess you would say. So do you associate then, because there's so many practitioners out there, certain practitioners with certain conditions you would send to based upon the feedback that you get or the reputation that they've managed to establish in the area?
Mm-hmm. Yeah, so I think that's a good point. I send basically majority of my head and neck cases to one or two practitioners, and I think this is my sort of personal belief that even general practice is going down to special areas of interest. When you read someone's bio, there's usually identified, women's health or chronic pain sort of thing. So it's heading in that direction where you just sort of identify areas that you're interested in. And I think the same probably could be applied to allied health, where I think if a person came to me and said, I am an expert, not in so many words, but if I feel, hey, if I have a really hard shoulder case, I'm going to send it to this person. And then I know next time I see a shoulder pain case, I'm just like, yep, this person's going to be the one that I'm going to be sending it to. So that specialty area of interest, developing that, and that might take a little bit of time. But you might already have an area of interest that you haven't really identified on paper. If you're seeing the fourth shoulder in one day, then that's basically the area that you enjoy seeing, or the patients keep coming back. So that becomes what you can tell everyone, basically. So I think this is a larger discussion of even personal branding sort of thing, where you can, how do you talk about yourself? And Jade, I know you're an expert in communication, and a lot of what the training that you've had is to do with that, and how to show value in that way. I think it's really important to be able to sell yourself in a way that doesn't sound like you're selling yourself. And special area of interest is an incredible way that you can sort of give someone confidence, because, hey, you can do the rest of the body as well, but you're just amazing with shoulders.
I think my two take-homes that I've heard you there is word of mouth is really important. And when I say word of mouth, it's the feedback from the patient is really important, because that's the contact that you have first and foremost. If a patient is talking about this brilliant allied health practitioner that they've gone and seen, it's the first time you've heard of them, then again, that's going to spike a bit of interest and a bit of curiosity. And then the second thing, which I'd never actually really thought about, is a website and how you write your bio on your website, because the next point of call is going to be, if that curiosity is spiked by a GP, you're simply going to do what we all do. We all head to Google and we all look it up, right? So you'd suggest that it is really important how you present yourself and your personal and business brand on a website, because GPs and health professionals are likely to look at that. I don't think people appreciate that enough, and I certainly don't.
Mm-hmm.
So
Absolutely.
you do find yourself Googling?
I Google everything. And the thing is, you, as a practitioner, you may not gel with every professional that you meet, and part of what I think would work, and there's so many strategies, but if there is a way, with special interest, you should be able to find GPs and other professionals, other sort of people who commonly refer to your specialty. You'll be able to find practitioners around you, and you'll know if you're a pelvic floor practitioner. There'll be a lot of GPs or specialists working with pelvic floor health. And and the big thing is, don't rely on GPs. We do refer, we do rely on allied health a lot with a lot of different conditions, but there are orthopedic surgeons, there are gynecologists, there are rehab specialists. So there are all these other specialties as well. And you may not need that many referrers. You might just need one or two referrers who really believe in your specialty that you've aligned with, and you've got a full book, for the whole week, basically. So it might take you some time to build that rapport with the right person, and you may not build rapport with every practitioner that you come across. There may be GPs who, I've sort of heard GPs ask the question, do you bulk bill? And that's the only thing that they want to know. And, if I know a practitioner really well and I trust their skills, because the two things I ask when patients come back is, how are you feeling now in terms of your condition? And how did you feel with the practitioner? So they're both equally important. In fact, you'd probably argue that the second one's even more important, because you can't really expect a significant improvement a lot of time just with one or two sessions. And what I always say is, look, they don't bulk bill, or they may bulk bill in some scenarios, whatever it is, but it's worth spending the time with them because, you know, they are the best and I look for the best. So I usually sort of talk them up in a way, because I believe in the people that I'm sending my patients to.
And I think that's great, because the buy-in from a patient and the respect and rapport that comes when a GP actually recommends somebody has so much value in it. But the take homes from a couple of things that I heard you say is, one of them is it definitely takes time. Like any relationship in society, you walk in, you don't expect to connect with someone straight up, you know. So building a relationship needs investment, it needs time, and it needs commitment, whether it be a personal relationship or a professional one. So be committed to the process, and obviously investing. If you invest into it, you'll get a lot more out of it. And secondly, playing to your strengths. I think there's some young practitioners out there who really want to go and start forming these relationships, and not just with GPs, but other allied health professionals in the area. But if you don't have the confidence necessarily to sell yourself, you're not going to put yourself in a situation where you're uncomfortable. So in a way of playing to your strengths, let's just say somebody didn't want to get their face out there, but they did have a brilliant skill set. Could they pre-record a video and send it via email? Or, you know, in regards to a letter, I know myself, I get a letter, I kind of put it off to the side and I think I'll read it later. What makes a letter memorable, and what do you want to see in it? Is it just 3 dot points? I specialize in women's health, I'm great with shoulders, send me all your wrists. Or, you know, do you want to actually get to know, or just say if you want to learn more, you can head to the website. Do you like to see photos? Just those sorts of suggestions. Is there anything that kind of stands out to you that you would like to see?
I generally find that I send patients to practitioners who I've seen in person. And if that means that you've given some information beforehand, written, video, a lot of the time in a practice where I used to work before, I'm not even sure how many documents I may not even have come across my desk. So I might be shown something or I might not, and sometimes you don't know what you're shown. So it depends on the practice, and also seek out practices that are sort of more new. Definitely new is good because you're looking to form a new relationship, but also there are, for chiropractors and osteopaths particularly, what I would say is integrative doctors can be a good source of referrals, and doctors who have done a little bit of training in nutritional environmental medicine through there's a college called Acronym, so you can look at who in your local town has been trained on the Acronym website, and they might be a good source. So what I normally say to my patients is, you know, a good chiropractor, a good osteopath, a good physio, they all do really good work. It's just the way that they get to the problem is different, and they speak slightly different languages, and that's fine. They all do really good work. So, you know, the decision to refer often becomes patient preference or what experience they've had previously with one sort of allied health. So those things are important. But what I say is, with if you're specifically looking for referrals from medical practitioners, GPs, looking for special areas of interest from doctors, and also doctors who are open-minded, you know, integrative medicine trained doctors, those kind of things can be useful.
And the next question on from that is, when you are trying to build these relationships, or when you feel like you've got a really good position or relationship with your patient, and then you cross-refer to a GP because you need some support with chronic pain, or I guess with some medication advice or something like that, and you refer to a GP. Often what happens, and I'm sure that there's going to be some practitioners out there watching, you send to a GP and the GP or the specialist sends off to their preferred practitioner. So you get referred from an osteopath, for example, and the GP or the specialist then says, well, that's all well and good, but now I want you to go and see my physio. My question to you around that, do we confront that, or do we just let it go?
That's a difficult question. Yeah, that's a difficult question. I think it's not unreasonable to contact that practitioner if possible, that medical practitioner, and not ask directly, but have a discussion about the patient's case and what they believe is the best course for the patient, and then sort of work out if your services could match that deficit. Would be how I would approach it. I think that's a really good question, and that way, hey, look, if anything, you've had a chat with them, they know you now. You can talk to them about your area of interest and your passions. So I don't see that being a loss in any way. If you can use that as an excuse to. One of the biggest things that I have learned is my personality is normally quite subdued, and I have more of a risk of being unnoticed, and that's been my case in my 20s, and sort of I've just sort of stayed away from meeting people and just doing my own thing. And I think in as a practitioner, it's really important to let people know what your passions are, what your overarching goal is, what your ethics, what your values are, and those conversations are really important. If you can have those deeper conversations with someone and they connect with you on that level, then, for example, one of the exercise physiologists that actually podiatrists are a good example, where I want to know that they're going to be looked after holistically and not just sort of just turnover sort of thing. So when they can talk to me about how much time they spend with the patient, what their values are, and those, it just connects with me on that level. But you also have to find the right practitioners or the medical practitioners who you can have those conversations with. So I think it goes both ways.
And I think that's the thing, in follow-up to my last question, when you have got a GP or a specialist referring off to somebody else, yes, you might be a little bit disgruntled, but at the same time, what a credit to that other practitioner for building that relationship, so much so that you're actually going to take a patient and deflect it elsewhere. So they've obviously done the hard yards, and rather than get disgruntled, maybe it's time to step up and show up and introduce yourself, even if you think that you're not going to get a good result. But it's worth a try, and you're only going to be one step forward than where you were before if you attempt to make an effort. And exactly as you said, you might introduce yourself and then become that person, and also get some credibility and respect for actually putting yourself out there and say, hey, I do provide value. This is my passion, and this is what I want you to know about me. So it could actually be a great catalyst for introduction, I suppose.
Yeah.
And so I guess on that note, one of my other questions is, what could we be doing better, I suppose, as allied health professionals in regards to those relationships? There are some businesses and practitioners that do it really, really well and have these wonderful relationships. Some of it probably comes down to personality, but could we be doing it better? Or from what you see, and I know that one person is a very small sample size across Australia, and I guess that's why I thank you for talking to us and being so open about all of this. What do you think we could be doing better, or do you think we are doing enough in regards to building these relationships?
I think allied health generally do a really good job, and when I meet them, and again, the thing is, there is one of the challenges that I even have is because of there'll be a number of people in the area that you work in as well. So it's about finding the practitioners that you connect with, and also being able to provide value. And if we step back, I think I mentioned personal branding or business branding. That's a long-term plan. So whether you're a business owner or a new grad, it's a process. It's a similar process where when you meet someone, that person becomes part of your network, and then, hey, look, they may not be a referring practitioner, but they're a contact, and making those contacts are important, regardless of where you are in your career. And the earlier you start, if you, For example, there are instances where someone leaves a job for COVID and they're, you know, let go from a job when they were doing really good work. And if you're well connected, you'll know who to ask, who to approach. And that's not even just for referring, that's even for a job or anything basically. So I think part of branding and marketing is having a calendar. So part of that weekly calendar needs to be to do with marketing. And that means getting in front of people, referrers or other gyms, for example. Gyms, I know some allied health are really heavily, instead of GPs, they're really heavily focused on gyms. Other sort of allied health professionals are really good at pulling people off the street because they provide a lot of value maybe online, and they're really good at that. So it could be all of those. So having those things blocked out in the calendar, and a monthly sort of calendar, doesn't have to be weekly, but you have all those things in there, and that just pays dividends over time, because you're more likely, you'll just be popping up everywhere. And I see someone once and I see them again, and I see them for the third time, and then all of a sudden I'm like, who is this person? I need to meet that person. And then one of my patients comes back and says, hey, I've been into so-and-so, they were really good. And then sometimes even without them having met them, I'll pick up the phone and contact them directly, or I refer a patient to them, sort of thing. So that can be useful, but it's really important to start and follow through on that.
And that's the beauty of word of mouth. The reach that it has is huge. And often it's not about, you can actually build these relationships secondarily. And networking should be for longevity and for the end game. And everything you do is investment into that end game. I think one of the things that, you know, I feel like it does fall on me a little bit as a business owner, that as the business owner, I'm the one that should be going in and talking to these GP owners and to these groups of GPs, because I've obviously got the experience or the confidence, or it is my practice to have to promote and market in the first place. And the roll-on effect of that is gaining a business with a reputation. But I would love to see more young professionals getting out there and marketing to GPs. But I think a lot of them do fear that, you know, lack of confidence, I guess you would say. So if you are a young professional, you know, would you better find that first connection coming from the business owner to get credibility, or it doesn't matter who it is as long as they've got something to offer? And I think I'm asking this question because I know that there's a lot of young professionals out there who kind of think, firstly, well, A, that's not my job. B, I'm not confident enough to do it. Or C, they don't really want to hear from me. They'd prefer to get an introduction from somebody else.
Yeah, look, I mean, that's a good question. And like what I said, in my early 20s, I was just head down, do my work, not shake not cause any trouble, and stay out of the limelight. And that will only get you so far, basically. You won't know how much of what doors are going to open by just going. And even if it means you have to go in with the practice owner, just go and meet as many people. It doesn't even matter if you don't feel you've made an impression. Like you probably did, or you're not gonna. It's not like you're gonna say something bad. There's no such thing. Just go. Just be open. Have a conversation with them. Find out what they're actually even. What kind of patients do you like seeing? What's your special area of interest? Just ask questions. When I struggle to make comments, I'm kind of bad with small talk, by the way, but when I struggle with that, I just ask questions and I get away with it. So if you ask questions, you end up looking I think I end up looking a bit more smarter and things like that. So yeah, look, ask questions and just meet people. That's
certainly one of the things that I do when I go in is you don't make it about yourself. You don't say, hey, can you refer me all these patients? Hey, look what I can do. Look what I can treat. Look what my specialty is. Yeah. First and foremost, my first meeting with a GP, if you manage to get one, is be grateful that you've got it. Half the time you've got to run the gauntlet of getting through the practice manager. Secondly, absolutely. I've taken lunch before. If you're going to take up practitioners' time and you want to be memorable, then you take a whole lot of Nando's chips or cupcakes. I've done all of the above. You need to value somebody's time in an effort to get respect back in return. And so, yeah, if you need to schmooze, it's not about schmoozing. It's about respect, that you are taking up somebody's valuable time and you want to offer value in return. That's simply what a trade is, and that's how relationships start to build. So, yeah, I've definitely done that. But I've gone in and just said, look, I intend on being here for a long time. My clinic is set up. It's in the main street. I have a vested interest in the community, in the care of my patients. I work with my heart on my sleeve, and I'm here to build a relationship, because whether you like it or not, I'm not going anywhere. And I see so much value in you. There's so much that I can't do. I can't do this on my own. I've only got a certain scope of practice, and I would love to be part of that network. So in particular, and this is what my question would be to you right now if I asked you that, what sort of patients would you love me to refer to you? Because I've got my 50 patients a week that I'm seeing, and I myself am looking for a GP to refer to. So which of my patients can I best refer to you, and how do you want me to refer them? Do you want me to send it off with a letter? Would you rather me pick up the phone? You know, I've done this for years, and we've got over 70 GPs that we work with on a regular basis because this is work. So what would you like? How, you know, if I was coming in as an allied health professional, how would you answer that question? What sort of stuff do you love?
Yeah, so look, I mean, actually, no allied health has actually asked me that. I don't think anyone's asked me that question. I could be wrong, but I don't think anyone's asked me that question. But that's a great question, and then it gives me an opportunity to talk about what I'm doing, and that's what my passions are, and I think there's value in what kind of patient, but also why they're interested in that. And again, the more deeper you can go with, the more of the why and the emotion and that sort of thing, that's where you can connect more. So if you can lead conversations, and Jade, you're probably the expert on this, if you can lead conversations more from the factual and more deeper into why and why people do things and what motivates them, what really annoys them, you build that connection faster, and it's a more lasting connection. So I think what you said is correct in terms of asking what sort of patients do you like.
And it fuels a mutual, which is the important word, a mutual conversation. If I sit there and I say, look, I do a lot of obstetrics work and pregnant women, and you turn around and go, oh, I actually love women's health. Really, do you? You set up an actual conversation. And from a conversation generates connection, rapport, and relationship. They're the 4 stepping stones to actually how you get there. But you actually need to take a vested interest in somebody else other than yourself. And a GP, by default, is just another human being that you're having a conversation with. So that's what, you know, in my experience in building these relationships, that's where I guess I would see the most value is I actually don't want to see them as a GP that I just refer to. Half the time now, and I am blessed with the relationships that I have, and some of them are in this group probably watching, is GPs now or dentists or exercise physiologists. I don't write letters anymore, which is bliss as well. It's less paperwork. But I simply pick up the phone. And we've also got an affiliation with a few GPs near us where they come and do educational stuff. I say to them, you have got this great specialty. I love what you do. Can you please come and talk to my team and do a PD lunch for us, because I'd love you to meet them. Indirectly, you're showcasing their expertise. Absolutely. And secondly, you're introducing them by default to the rest of your team. So if somebody asks you to do that, would you be open to something like that? I mean, you're an open-minded GP anyway, but is that something that you love doing, is educating?
Yeah, absolutely. And I've been requested to do a couple of talks like that, and you get to meet, you know, even psychologists have been recently suggested to do a talk to them. So if that could be one strategy, if you've got a team and an area of interest where the doctor's practicing, organize that. The other thing is, again, just emphasizing, GPs aren't the only doctors. There are orthopedic surgeons. Find an orthopedic surgeon, build a connection with them on a specific, if you're a shoulder guy or a shoulder girl, find that person who's doing really good shoulders and say, you look, you're the shoulder person that I need to talk to, and I really want to learn more and go into theater, whatever you have to do to build that trust with them. Hey, it's not just about building trust, you're also learning from seeing surgeries and whatnot. So it's great. And then as a business or independently, if you can do like a co-joint sort of a session workshop with an orthopedic surgeon, great. I mean, that's just mutually beneficial for the specialist and the allied health professional.
And I think the other point that I make when I'm talking to my team or when anyone about building these relationships is we are all very time poor. And if you can make something as easy as possible, you need to do it. And often I've had practitioners that present to me to say, I've tried, Jade, I've sent letters. And I'm like, well, firstly, are you following up on those letters? If you write a GP a letter or any professional, for example, and say, hey, I'm Jade, this is what I do. I specialize in shoulders. I'd love to chat. Please call me and organize a time. That's not going to happen. You're not going to have a very busy orthopedic surgeon call you and say, hey, thanks for your letter. I think I'm free next Friday. So the second step for that, and what I would usually do, is you go to the person who's got the calendar. And that's usually their practice manager or their reception staff. So they're the ones that you kind of want to work your magic on a little bit. They're the ones that call, and we'll often ring them and say, hey, what's Dr. Varma's day looking like over the next month? This is what I have to offer. This is what I want to bring the team. I've got a whole CPD presentation put together on acute bursitis of the hip. And I'd like to educate their team. Have you got a 1 hour window for me? I'm going to provide lunch. Can you please let me know what suits? Easy. Yeah. Then you either get delivered a 1 hour time slot, and in actual fact, more often than not, and tell me if I'm wrong, the practice manager goes to the GP and says, hey, this is what's going to happen. I've booked it in on the 23rd. Are you okay with that? And you go, yeah, great. How easy is that? How you find it works in your clinic, or are we totally different doing what we do?
If it's in my calendar, it gets done. So if it's, and the girls at reception or the practice manager, they control my calendar. So if it's in there, it gets done. So absolutely, whatever needs to happen to get it in the calendar is what and it may, if it's not an hour, half an hour, whatever it is. And the first point of call might be even just to say hi. That could be all. And then when you're face to face with them, you have the opportunity of saying, hey, we can organize something a bit bigger or that sort of thing. So just get in the calendar.
and I think that's my point, and that's what I wanted to suggest to most people. You can write all these letters that you like, but ultimately you've got to get to that booking calendar. So I'd love to hear from the comments from some of you of how you've gone about approaching GPs, whether you've found going through the actual admin team and the practice management to book those appointments, or whether you do find that writing letters helps. We also give out merchandise. We give out huge, big umbrellas. I mean, anything to make your business name memorable. We constantly are giving out pens and notepads and all that sort of thing, because it's a quick reference. If you're not front of mind, you're forgotten. And I think you probably, we need to realise that more, that we need to be putting effort in to these sorts of things, which kind of takes me on to my next question. And apologies to everybody who's watching. I had a huge slide presentation, but it's totally disappeared. And with my tech issues at the beginning of this, I didn't actually want to risk mucking it up anymore. So I'll provide the slides and the questions that I am asking in the members area afterwards. But one of my other questions is, whether we like it or not, we have a stereotype bias. Evidence supports that we make judgment calls and we judge somebody within minutes of looking at them. There are stereotypes attached to certain professions. Now, you have a growth mindset. You're one of the more open-minded GPs. Are there still these stereotypes going around that allied health professionals have to deal with? That chiropractors just crack, or physios just prescribe exercises, or as an osteopath, when I first started, I was called the witch doctor in Coburn's Road. Do these stereotypes still exist, or are you finding that more practitioners are a little bit more open-minded to, getting to know and breaking down these stereotypes?
Yeah, I think it is getting better. at the same time, I have a lot of patients who feel that they go to any of these professionals and they didn't offer a massage. So there still is that, what's the difference between a remedial massage or like an active treatment, or strengthening the area, or there's a significant sort of misunderstanding. And like what I said earlier, part of what I do is educate, in terms of there are all these allied health professionals and they all do really good work, but they look at it differently. So if you go to see if you are educating clients or seeing practitioners, in terms of, there could be a way that you introduce, if there are any misconceptions, introduce the way that you would practice, so that you can clear, and you can have those, you can sort of work out where those misconceptions are, because you've probably heard them before, and you could sort of have a neat way to say, hey, that's not actually what I do. I actually do this, and these are some of the benefits of what I do. And this is how I'm different from the other guys. And they do good work as well. They look at it from this way. I look at it from this way. We all do really good work, but there are benefits to the way that I do something.
And that's a great point, is you can only speak for your own profession, and it's not in good taste to use another profession to rise yourself up. And you hear about the old school practitioners who've sort of done that all the time. Don't see them because see me. I think if you only deliver the information that you know, and if it only falls down so much as how you learn at university and what the course structure is like, physios do this long at uni and they do their placement in a hospital setting. Osteopaths start treating in a private practice. They're specifically trained for private practice and do postgraduate rehab, although we're doing more rehab at a university level now. Chiropractors are specifically trained for private practice, and they've got more experience in prescribing for imaging and those sorts of things. Apologies if I've got any of those wrong, you've got me on a whim, but using those tools. But the way that I kind of go in is I talk about and give examples of the 3 patients that I saw that first thing in that morning. I'll say, for example, I saw a really acute lumbar disc bulge, and this is what I did to manage it. I saw a young 12-year-old boy who'd rolled his ankle playing soccer. And then outside of that, I saw an 8-year-old woman with degenerative change in her knee. If you give those examples, you create a beautiful picture of your scope of work and the patients that you can actually deliver change to just by giving examples.
Yeah.
So I think that's a great way to address it as well.
I think that's excellent. And also just on that, with those examples, even saying, maybe if you're not a physio, saying a physio would treat it this way. If there is a way that you treat something that you feel may benefit and is different to the way that one of the other allied health professionals would treat something, and you found that you're getting a lot of those where you've seen someone else work on them and you've been able to help them when maybe someone else hasn't, then highlighting that in an elegant way is useful as well. So there'll be patients that have seen someone and they're still sort of maybe 50% there, but they're not quite there yet. So if there is a way that these half-treated patients, if you can help them and you can identify or let referrers know that this is how I would do things differently, and I've been able to help people in this manner using case examples, I think that would be very beneficial.
And that's what we do as an extension of that, is once I present those, I'll open it to the group of GPs that I'm talking to and say, have you got a patient right now that you're having difficulty with? You are umming and ahhing about who you would refer off to. Give me that patient and I'll let you know how I would manage it. And that's one of the other things. We've taken our shockwave machine in to show GPs how to use it and how it works and those sorts of things. But yeah, opening it up and just, having that as an education platform. So right now, I'm going to test your preconceived injury referral basis. Yes. I'm going to throw at you plantar fasciitis. Who do you first think? What allied health professional pops to mind first in regards to who you refer to?
Plantar fasciitis, I will probably do physiotherapy first.
Okay, I'm not going to get you to extend. I'm just testing the biases so that those people watching know what they can be educating GPs on. What about chronic lower back pain?
Chronic lower back pain is open court really. Because usually they've usually seen someone before, maybe had a little bit of an improvement. So it's all three.
Yeah. So rather than choose a modality, for example, you would choose more a practitioner that you've got a relationship with.
Yeah, and patient preference. You know, they might say I've been here before, and you know, yeah. So depending on patient preference, but also who. The other thing is who I think the patient would get along well with and will stay in a treatment course with as well. So that's important.
And I love that you said that, because you need to be referring to, and this is why I constantly bang on about how allied health professionals and healthcare professionals are leaders. Leaders are people who influence and provide impact, even if it's just one person. So to get a better patient outcome, evidence supports that if you lead a patient or facilitate a patient through a treatment plan, you're going to get a better result. And you've just proven that for me there, is you're going to choose the best person to influence the most,
Absolutely.
the best outcome for that patient. And personality plays a big role here. And if you genuinely, and I'm going to say it here, rightly or wrongly, if you like somebody else, you're going to send to them first, right? And what about headaches?
Headaches would be, actually, that's all three as well, actually. All three as well. Yeah.
Tennis elbow.
Tennis elbow would probably be physios.
Okay.
Yeah.
So what about, is there anyone that, any condition that comes front of mind that you would refer a chiropractor to a chiropractor straight away?
I think neck pains, they do really good work, and I've seen some really impressive results with that. See, the thing is, and that's where if I've said tennis elbow and you feel, the person listening to feels, hey, I do really good work in that. The thing is, if I don't know, then I don't know. So these questions are important, actually. Yeah.
And I think that, look, this is part of my impromptu experiment that I've just thrown you into. But hopefully for those people that are listening, what I'm trying to do is just literally, we cannot assume that GPs are educated on our individual scope of practice. And those people that are investing time into educating the networks and the collaboration of support around them are going to be the ones that thrive as a referral-based word-of-mouth network. And you can sit there all you like and say, I don't really need these networks, you know, if GP is going to be closed-minded. It's actually not about GPs being closed-minded. It's about the fact that some people haven't taken the time to go and educate them. You know, GPs is pretty universal, but we have so many differing scopes of practice that unless a GP sat down for half a day, even myself, you know, if somebody came to me and said, can you explain the scope of practice of a myotherapist? I could probably have a go at it. But if a myotherapist came and approached me and said, this is what I do, this is what I'm fantastic with, then I'm much better equipped to kind of deal with that. It's not up to me to research myotherapy on the off chance that I might refer. So my point is do the work. Do the work, build the relationships, and don't assume anything. You can't assume that those GPs in the area know what you do. Half of them don't know that you do or don't do dry needling, that you're a practitioner that doesn't ever manipulate, and you might be a chiropractor who doesn't crack. I mean, there's so many out there, or an osteopath who only works cranially or doesn't. That we've got our own stereotypes within our own professions, let alone assuming that the surrounding referral network is on top of it all. So, you know, part of my passion is growing allied health and allied health leadership, and that's why I'm so passionate about building these relationships. And so, sorry to kind of throw you on the spot with some of those questions there, but I think with that, having this conversation, even sitting down and talking to a GP who is giving up their time to help build those relationships and educate us, what excites you about healthcare for the future?
I think healthcare is, like I said, it's becoming more specialized in certain ways, but it's also becoming more foundational. So in terms of being able to build rapport quickly with patients and with other professionals, and the networking side of things is becoming very sort of more dynamic. And it's very interesting. And again, the other thing is, I mean, social media. The thing is, it's free. The social, I mean, doing videos or you know, even webinars and things like that, it's actually, it doesn't really cost anything. So there's countless ways to educate patients, be out on social media, and it doesn't really cost anything apart from maybe a little bit of time and effort. So the sphere is changing, but it's also, you know, special area of interest is very, at least in the beginning. Ironically, the beginning is when you sort of, and then once you have trust, then they send you the knees and the hips as well, along with the shoulders. But initially, that shoulder might be the one that gets you, saying you've an interest in the shoulder might be the one that gets you patients initially. So yeah, it's becoming more dynamic, but at the same time, you know, networking side of things is very important.
And so off the back of that, what excites you about healthcare? What are you still concerned about with the future of healthcare?
Future of healthcare, I think, I mean, there's so many challenges. How do you
I'll probably narrow that down. In private practice, I would probably say, you know, is there anything that sort of concerns you with the way that, you know, allied health professionals are going? You know, what are your thoughts maybe on the fact that evidence-based medicine, are you very for it? Or there's a lot of things that are hard to get evidence-based in private practice?
Yeah, look, if a patient gets a benefit from something that I haven't prescribed or recommended, I'm okay with that. If it benefits them, you know, and they're finding it beneficial and there's no real necessarily harm that I can see, I'm okay with that. So I think being more fluid is the way, and leveling the playing field. So it's not about giving them advice, it's about, you know, giving them options. I mean, we know all this from uni because we've done a communication course in uni, all of us. But it's more than that. It's about really empathizing and going deeper with that patient and finding out their why and connecting with them on that, and following them on their journey, sort of thing. So it's, the communication style is significantly different, and I think the practitioners that are able to do that will do really, really well.
And one of the great questions that we've just got in the comments is, what should allied health professionals not do? What is one thing that you hear that they do that you think, gosh, I wish they didn't do that, or why do they keep doing that? Is there anything like that that kind of comes to mind as an example?
Actually, not really. The allied health that I work with, there isn't anything that really bugs me. Or maybe if there is, I just have a chat with them and we sort it out. So nothing really stays on my mind. No, I can't think of anything specific. And the thing is, if there is something that's the other thing, you know, if there is something that bugs you, it's always, and with my team here, if there's anything that bugs them, you know, I'd rather they, instead of coming to me, they can always come to me, but we always encourage sorting that out with the person, you know, and that's, I think, really important when you work in a bigger sort of team, or even a smaller team, where if there's an issue, just have a bit of a chat and solve that, and win-win, not sort of a compromise, and you move on and you know, solve that issue there and then. So I don't really have anything that I am particularly sort of bugs me on an ongoing basis.
Well, I think I speak for everybody who's listened to you today that we all want a GP like you around the corner from us. I mean, that's pretty clear. You're so open-minded, and even with your interest in education and freely giving up your time to talk to us all and help us with, you know, building these relationships. You've got a vested interest in, and I'd love to hear a little bit more about it before we finish up, on the cannabis side of things. I mean, that's very new, and that's a very open-minded a new thing. We certainly don't get that much in our area, and maybe it is affecting more up there in the Sunshine Coast. But I'd love to hear more about your work with that.
Yeah, so medicinal cannabis was, I basically stumbled into it, and it was a matter of finding the most difficult patient, and where nothing else worked, you know, I considered that as an option, and basically went from there. And when there was that clinical benefit, and again, we can talk about the evidence being quite minimal at the moment. We can talk about there not being significant randomized control trials and that sort of thing. So it is an emerging area of interest. And the discussion that we have with patients is, hey, you tried X, Y, and Z, a number of different things. You're still experiencing this and that. Would a trial of this can this be considered? So that's where it started, and that's the same process that we have at the moment. And it's good to be offering something, for a lot of these patients who have tried a number of different things. So it's important not to overpromise in this sort of scenario. Be realistic, as with all professionals, and keeping that sort of clinical side of things, but being able to offer that in a professional sort of level is quite rewarding, actually.
Fabulous. Well, I could talk to you about this all afternoon. I just wanted to say thank you so much for joining us today. It's been a real privilege to have you, and again, hear how open-minded you are with these conversations and the value that you see that allied health brings to healthcare. We certainly know your place and your role in ensuring that our patients are looked after. So thank you so much for your time. I'm sure that if anyone wanted to connect with you and contact you after this, that I'm sure that they're more than welcome. But we hope to see much, much more of you, and I think it's a matter of watching this space for you and where you're headed, because I think you're definitely things up there in private practice and also in education. So thank you very much.
Thank you, Jade. And also, we've only recently become acquainted, but I'm very excited about your project and your passion in education, and also what you've built in such a short time as well with your tertiary education and things like that. So it's very nice to sort of cross paths, and definitely looking forward to continuing some of these conversations as well.
Thank you. Thank you very much. See you later, everybody. We'll see you next Thursday. CPD will be available for immediate download in the members area. If you aren't a part of it, I'll put the link in this video. Sorry for the tech at the start, and thanks for getting right through to the end. See you later, everybody. Bye.
Bye-bye.